I am incredibly excited to have you on the show, Taiwan. So I'd love for you to begin by sharing who you are and what you do in healthcare.
Thank you for having me. My name is Tywan Mata. I have a background in care coordination. I've been doing care coordination for about 10 years. And prior to that, I ran a housing program for patients with severe mental illness. And then I worked in child welfare for about 5 years. And in child welfare, I worked with patients that had a substance use condition as well as a mental health condition. Um, and in terms of my care coordination experience, which is the most recent experience, I started out working in an HIV/AIDS COBRA program. So the idea there was that we service patients that qualified for Medicaid and that were HIV positive. That program then transitioned into the New York State Health Home program, where I worked in health homes for 8 years. And now I work in a care coordination program that's primarily focused on patients with asthma and other chronic conditions.
From your experience, what are some gaps that exist across the care continuum for patients?
I think if we can look at it in a lot of different ways, right? We can look at it by chronic condition. We can look at it by race. We can look at it by class. Um, but I think the most simplest way is to kind of look at it in a more general sense of what's happening in healthcare now, right? Um, the most gaps that I see and what I struggle with the most are the gaps that exist in the neighborhoods that are underserved and that are really the Black and brown communities. Um, the gaps are lack of access. So, patients oftentimes have to travel outside of their neighborhoods to access specialty providers. Um, I also have, I've encountered where providers are not oftentimes sensitive to patients' culture and language. So that's a gap there, right? If a patient is not able to communicate with their provider, um, we can talk about, the financial piece as well. Patients are at times often faced with high copays to meet with specialty providers. So you can be a working person with 3 children, but have a $20 copay to see a provider or a specialty provider, which will then limit your access and it presents as a barrier. Um, I think we can talk about this for hours, right? We can talk about all of the gaps and the needs, but I think ultimately um, the biggest gap that I would see is lack of access and Black and brown communities.
Do you see any opportunities for policy to address some of the gaps that exist in access as it relates to patient resources or patient care?
I think COVID-19 has placed a spotlight on the disparities that exist in Black and brown communities. One of the things that has been really been pushed and people are utilizing is access to telehealth, right? Um, a few years ago, telehealth was not existent, or MCOs didn't want to pay for it. Or it was looked at as only for the elite people, only for elite or people that seemed certain providers will have access to it. Now I see, the average person that utilizes the safety net system, they're getting telehealth visits, and it's successful. Patients are getting care. They're able to access prescriptions in most cases, and the providers are sensitive. I think that with this crisis, I've seen more sensitivity to patients' needs as a result of this virus. So I think we could capture what's happening now and create policies that kind of align with the barriers that patients present with, right? So telehealth, for instance, can address issues around childcare, right? If a new mother who has 3 other kids, getting to a provider, it's a whole hassle by itself. Think about it. a patient with a newborn baby um, that has to get 3 kids ready on top of the newborn and then take the bus or the train, that's a barrier. But that new mother could take care of herself through a telehealth visit, as opposed to having to get 3 or 4 children ready to make it to an appointment. So that's one part of it, right? And then telehealth can also address the elderly population, right? In many cases, transportation is an issue in that population as well. And then we can talk about the younger generation that just doesn't want to sit and wait for a doctor, right? So they don't want to sit in a waiting room. Or maybe there's an issue around disclosure. So depending on the patient's condition, maybe there's an issue with going to a particular clinic. So having that telehealth visit will allow to kind of decrease some of that stigma as well. And then we could, you can look at mental health as well. I grew up in an area where there was a particular mental health facility that everyone knew, and they would say, that a certain person went there, someone with a severe mental illness went there. And they were labeled that way. So the idea is that telehealth could work to address that as well. So the biggest thing I take, or one of the biggest takeaways is telehealth, right? And its ability to bridge the gap for many people. But there's some issues with this. It's not a quick fix. There's also people in our communities that lack the technology to access telehealth. And for those reasons, it's I say that telehealth is good and it can help to address some of the gaps, but it leads me on to another pathway to talk about the disparity and access to technology.
Something that you just said that stood out to me in regards to telehealth and telemedicine is around access, and more specifically around digital redlining. And most people may not know, but what digital redlining is it is inequities that exist through marginalized groups, already marginalized groups, in which there's no access to the internet or technologies. So when we see an uptick in telehealth and telemedicine, I'm curious to know where the underserved, already marginalized communities are.
You're going to hear a lot of people talk about telehealth because it's proven to be helpful. And I can speak to my own experience with working with patients and how helpful it's been, especially in terms of the patient population that's most likely to have an adverse reaction from COVID or die from COVID are the patients that we've been targeting to utilize telehealth. So people with an underlying condition, people that are over 50 or 60, people that either were exposed to COVID, people that had COVID, but it's not really clear if they're contagious or not. So those people, we've recognized that telehealth has been helpful. And for the most part, there hasn't been a lot of issues around connecting patients via telephone. However, I can say that my experience has been that video conferencing has been a barrier, and it has been a challenge to get patients onto Zoom, onto any other video chat software that you can name. It's not easy, and it could be for several reasons. Again, we can talk about the age difference, the lack of understanding around technology. We can talk about the mistrust, right? Because that's another part that you're and putting on this camera, you're inviting someone into your home. So that's another issue there. We can talk about the issue around privacy, because I have you on camera, my family has access, they're hearing, I may not have a private space to have a conversation with you. So there's tons of things that we can talk about that come up in terms of the video piece and that technology. But I think as time goes on, there needs to be more education to patients about it. There needs to be some sensitivity, you know. Providers should be checking in with patients. Can we have this discussion now? Or maybe before the visit, are there things that we should not touch on? So like that preparation that goes into it. And then the community support, which is important. So I work with a team of community health workers, and their role has been vital in understanding and making that connection. They are the ones that are actually trying to get patients to utilize the technology, that are prepping for the visits, that are reminding the patient that, you know, you have this telehealth visit. And then they're doing the follow-up work. So if there's a change in medication, if there's a need to have medications delivered, if there's a need to coordinate with a specialty provider, so sometimes a patient may have a cardiologist, a primary care doctor, and maybe even a pulmonologist, right? And they're gonna connect the dots and let the cardiologist know what happened on that call so that the care team, that everyone is on the same page.
We know that community health workers are the unsung hero of healthcare. I myself am coming from a background of care coordination, and you being a social worker, we know firsthand what those experiences are like, the gaps that we fill for patients, and the roles that we play. What part of the narrative, or what role do you see community health workers playing as we are navigating COVID 19 and post COVID 19? How should they be leading discussions around underserved populations and healthcare access?
Community health workers are like the untold story to healthcare. I'll be honest with you. Um, Community health workers represent, and the case of my company where I work at, they represent the patients that we serve. They speak their language, they understand their culture. Many of them share culture with the patients that we service. Um, and they also understand the systems that our patients interact with. So they're able to help the patient navigate. Um, they're able to give the providers a perspective that they probably wouldn't get any other way. The providers in most parts, and this is not a criticism to any provider or clinician, they're not able to leave the four walls of their hospital or office, but the community health worker is. So in a large part, we're an extension of the care plan. Let me not say care plan, of the treatment team, of the interdisciplinary team. So I think what needs to happen is that there needs to be more respect given to the community healthcare worker, or the community health workers. Sorry about that. There needs to be more respect given, and then there needs to be more collaboration on the part of the clinician as well. So the community health worker is going to bridge that gap for the provider. They're the people that are going to say, you know what, this medication was prescribed for you. There's this copay. Let's find out, how do we assist you with getting this copay paid? Let's figure out if there's a coupon. Let's call back the provider to see if there's an alternative or a generic brand to this, which will then eliminate the copay, right? So those are issues that providers are not able to address. Providers are not always able to address those issues, given the fact that they're also overworked and kind of stretched thin, right? So the community health worker is going to drive those efforts, in addition to addressing, to your point, the other social determinants of health. So, you know, food insecurities, safety issues. In many cases, my team, we're connecting patients to Safe Horizon if there's a DV or intimate partner violence issue. So, I mean, pretty much, if you think of most of the gaps that providers identify, and most of the gaps that providers are not able to address, the community health workers are able to address. And in this COVID crisis, I've seen the work that they've done, and I know the value in it. And my hope is that everyone will see the value and the work of the community health worker.
I would love for you to give some example of ways in which underserved patients, underserved communities can gain access to resources, whether that be local to the New York City area or it may be on a national level. Any piece of advice would be greatly appreciated.
Look at the news, right? So I've seen news conferences in different states, and usually there's a phone number provided for food or for some other assistance. I would say start there. That the first connection you make to someone that's just willing to help, um, it will allow you to access other resources. In New York City, we have access to 311, which is a pretty good service. I mean, they provided tons of support to patients. Pretty much most of the public accessible benefits you can access through 311. But for other states, if there is a patient out there, or there's a healthcare worker or a social worker or a community health worker or a neighbor that just wants to help a patient or someone out, I would say start with utilizing what's being offered publicly by either your politicians, your local governments, and ask questions. You know, if there's a need that you have, ask questions. And you know, you may not get the answer or the resource you need right away, but I want to believe that it's available and that it may be out there. The other option, I would say, on a national level, if there's someone out there that needs help, there is an organization that I'm not totally familiar with, but I know my company is a part of, and I've been on calls with them. There's the National Association of Community Health Workers. And I believe that if someone had an issue in a state that where resources were scarce, they can probably reach out to them and get connected to someone to help. I wish I knew more about the country, as a whole, but I don't. But I can speak to New York City in particular. There's 311, depending on the need. If there's anyone out there that has a domestic violence issue, I would say Safe Horizon. You know, there's tons of services there. If you have a need specific to COVID and you're experiencing COVID symptoms, there's the 1-844-NYC for NYC, where you can actually call and have a discussion about your symptoms, speak to an actual doctor, and get guidelines and steps to take to address those symptoms. And if testing is necessary, they'll also set you up to be tested for COVID as well. So depending on the need, I definitely think the NewYorkCity.org is a good place to go.
So oftentimes people of color and lower income folks feel that their voice is not being valued in healthcare settings. How can people of color, low income folks use their voice in this time as we're navigating a crisis so that they're gaining access to the resources and the access that they need so they can truly thrive in their health and well-being?
I think ultimately, start with your provider. If you're a patient and you don't feel comfortable speaking to your provider, get a new provider. It has to start there. It starts with that therapeutic relationship between the patient and their provider. And again, it's not a criticism, because I work with providers, and most of the providers that I've worked with, they care and they get it. They understand the work that we do. But I also know that, patients, depending on culture, my background is Trinidadian, right? And if I talk to my grandmother and I ask her, why does she take this medication? She'll tell me the doctor said so. So asking questions around, why are you taking this medication? What does it do? And just trying to understand it as much as possible. And if the provider is busy and you're in a big hospital system, ask for a social worker. My background is also social work, and I know the importance of the social worker role. So utilizing the resources, ask questions. There's no dumb question. And I would say to every patient that's accessing care, it's almost like a service that you're buying, right? So if you went to a restaurant and the food wasn't good, you wouldn't go back. So I think that should also be done in terms of healthcare. And there should be ratings. I think providers should have ratings. Their practice should have a rating. The hospital should have ratings, and it should be public, because there are some ratings that exist, but it's not always public. The same way in New York City, we have grades in restaurants. They have an A or B or C in front. There should be ratings to allow the patient, who's ultimately the consumer, to make a informed decision.
So, my last and final question is, what is your call to action in improving the health and well being of patients of underserved communities and lower income folks?
Um, I think the areas that are being hardest impacted by the COVID-19 virus, the people that are turning on their TV and seeing their sons being brutalized and attacked, the people that are losing their neighbors and their sons and their loved ones, the pastors that are losing their members, the school teachers that are losing their students. I think that if we as a community continue to put this issue at the forefront, it can't disappear when this crisis is over. And we see that time and time again. We see, people march, or we see people protest, and then it just stops when, someone is convicted, or some maybe not convicted, or, there's a policy around HIV, or a policy around drugs, and these things impact our community. We have the worst schools. We have the most drugs in our communities. We have the most violence. We're mostly over police, right? So we have to be deliberate about how we advocate for policies. We have to be deliberate about the services that we accept, and the services that we invest in. And then we absolutely have to hold our politicians and the policies that are made accountable. And I can't stress that enough. And I'm calling on the pastors. I'm calling on the small business owners. I'm calling on the school teachers. I'm calling on the neighbors. I'm calling on the sanitation workers. I'm calling on everyone that is aware of this crisis not to stop. We as a community have to make a difference. And if not, it may not be COVID-19. Maybe there's another illness, and it's going to have the same impact. When does it stop? When does it stop? Time and time again, you hear the Black community is impacted the most. Or you look at the news and you see the school ratings, and it's like the worst school ratings are in our community. So we as a people, we can't get comfortable. And it may not be for us. Maybe it's for our children. Maybe it's for our grandchildren. But we have to make a difference. And I would just say one more thing, that our dollar means a lot. So we have to support people that support us. Our dollar should be invested into companies that support us. And if there are policies that are made by politicians or companies that do not support providing more access to healthcare, or they do not support getting rid of co-pays, then we shouldn't support them. We shouldn't support them. They shouldn't get a cent from us.
Thank you so very much for spending this time with me, Tywan. I've gained a ton of knowledge, and patients will too, caregivers will. I thank you on behalf of all community health workers, and thank you for the work that you and your organization are doing to address the need of access barriers to people of color and low-income families. Thank you.
Thank you for having me, and I appreciate the work that you're doing. You keep it up. I think our patients, the work and the documentary and the app and things that you're working on, I think it's another tool that should be absolutely utilized in a clinical setting that will support the patient's ultimate goal of better health outcomes.